fairly common condition that you're seeing a lot of in the studio, in the surgery at the moment, aren't you, Dr. Poonam? And it's something that people don't know a lot about, and that's fibromyalgia.
Yes, fibromyalgia. It is a chronic problem. It's a chronic condition that causes widespread body pain and extreme fatigue. And although it is common, there's very little that's understood about it. And as a result of that, what happens is what is a complex condition is even harder to deal with for those that have it.
Yeah.
So what the underlying mechanism is that we think it's related to a change in the way that the brain and the spinal cord process pain. So people with fibromyalgia tend to have abnormally high levels of the certain chemicals that signal pain, so they tend to be very sensitive to pain. Now, it can run in families, it's common in women, but it can often develop after some form of trauma, which could be things like a fall, an accident, surgery, childbirth, and even viral illnesses.
Yeah, and it's called, apparently, the imaginary condition. Yeah. So many people, as you said yourself, do suffer from it, but it's not really spoken about. My mom has it, and she's been dealing with it for years.
Yeah, and it's an awful label to put because it is a very real condition. I think that one of the reasons is that because of the lack of understanding over the decades, people that are living with fibromyalgia, they're often stigmatised. Their symptoms aren't taken seriously, or they're often disregarded, which makes it very hard to live with. And some of the reasons for that is that there is an exact test for it, so it's often a diagnosis of exclusion. So you take the symptoms, you usually find not much in the blood tests and investigations, and therefore we arrive at this diagnosis. Now, I see this day in and day out in my surgery, so I see how patients really struggle. Closer to home, my mum has suffered from it for over 20 years. And I remember being at medical school, and you know what, it wasn't something that was talked about or taught even. I remember clinicians in those early days really disregarding the symptoms and saying, well, there's nothing wrong with you. But we watched her really struggle with pain and exhaustion. And we need more research, we need more awareness, we need more treatment options, because we know that if you have fibromyalgia, the studies show that you are at a higher risk of things like infections, of severe mental health problems, of accidents. And I think generally what we do need for everyone is to be more compassionate and supportive to those that are living with this condition.
Yeah, absolutely.
Sure. Like we know people are suffering. We know there's no cure. But Christine has been in touch, and she says, I suffer from fibromyalgia. So she has chronic pain all over her body and very little mobility. She says, is there anything that she could try?
I think the important thing to say about fibromyalgia is it can be very difficult to treat, but it's about having an individualised approach, because no two people will have the same experiences and challenges. When it comes to pain, which is one of the most prominent symptoms that people struggle with, so in Christine's case, it is to say that there's lots of options, right from painkillers and different types of painkillers to things like antidepressants, so certain types that can really help ease the pain. If you're living with chronic pain, it can be very stressful, it can be very distressing, it can impact your sleep. Trying to find ways that you can relax is really vital to that. So that could be things like meditation, mindfulness, cognitive behavioural therapy, all things that we as GPs can refer you for on the NHS. Acupuncture is also available. So if Christine has tried all these, maybe trying acupuncture might be an option. And as a result, if you are looking after your mental health, that will help with pain, but also you'll get better sleep, which is helpful too. Another really major symptom that people struggle with is energy management. Now, energy is such a precious commodity if you are living with fibromyalgia, which we all take for granted. Now, I had a patient that described it so well to me in surgery, and she said that she feels that she wakes up in the morning, and she described it as money on a credit card. So she was like, I feel like I'm topped up with energy in the morning. And I have to be really careful with how I spend my energy as the day goes on, because if I overspend it, it comes at the expense of a possible flare-up of my symptoms and exhaustion, fatigue and pain the next day. So you have to be really mindful of how you ration that energy out.
And that's helpful to understand it, actually, that analogy.
So that's if you know you've got fibromyalgia, how we can hopefully deal with it. But if you don't, what are some of the indicators that you should be looking for?
So some of the main symptoms, as we've talked about, is this widespread pain and tenderness, and It can affect any part of the body. There's muscle stiffness and extreme fatigue. Now, this isn't just tiredness. This is fatigue to the point where you cannot function and do basic everyday tasks.
Yeah.
There's other more milder symptoms as well. Another one actually that I want to mention is fibro fog. So a lot of people relate to this, which is it causes an inability to focus, to concentrate. It can really cloud the memory as well. And then there's things like headaches, there's bladder symptoms, irritable bowel syndrome, restless legs are just some. But fibromyalgia affects every fibre of your body. So it's important just to really, if you are struggling, to know that you're not alone and that there are options, and do speak to your GP because support is everything.
Yeah, that's really helpful. Thank you, Dr.
Thank you so much.